Well, we are a highly athletic community here in Vail Valley, and it's really important to have people to support us, to help us in case those injuries do happen to occur. And that's why I'm happy to have Dr. Braxton from Vail Summit Orthopedics and Neurosurgeons. How are you doing today?
I'm doing great. Thanks so much for having me,
Yeah,
Eric.
absolutely.
Yeah.
So you guys are providing a pretty unique support to the Birds of Prey ski race today.
Yeah, so we're providing care for any orthopedic injuries. I myself am not an orthopedic surgeon, I'm a neurosurgeon, so I'm on backup call, God forbid, if there's any neurosurgical problems.
Which could still potentially occur if you slip out and get caught in the gates and get wrapped up in things. You never know what'll happen to the
Certainly,
spine.
head injuries and spine. Anytime there's a violent shaking of the brain, there's a risk of concussion or a head injury, and obviously spine fractures are a concern when you're traveling at those kind of speeds.
Yeah, absolutely. And your focus, I know you're a board-certified neurosurgeon, so your focus is neurosurgery, not, you had a great joke. It's like you don't do knees and windows, right?
Well, I like to say I don't do windows and I don't do knees.
Yeah.
My practice is centered on the nervous system, so that's the brain and the spine.
Mm-hmm. And you're developing a really unique way of operating operating on the spine.
Yeah, so I came from the military. I worked in Afghanistan as well as in Germany, Korea, and in Texas, and I found one of the biggest risks to my surgery was the anesthetic. And one of the big factors is recovering from the anesthetic. So we started doing patients awake, and that's adapted really well to this environment up here at 8,000 feet where there's less oxygen. I like to do my patients awake, and there's really three distinct benefits for doing it without a general anesthetic, going to sleep with a tube to support your breathing.
Yeah.
So the first benefit is obvious. You eliminate the risk of general anesthesia. General anesthesia is associated in some cases with a little bit of delirium, being confused after surgery. It can be associated with having a heart attack or even having low oxygen. And at 8,000 feet, that's a concern.
Yeah, it's very dangerous, all three of those things.
All right, and I do want to say that general anesthesia is a safe practice, but I'm trying to eliminate that risk and optimize my surgery.
Yeah, which kind of goes hand in hand with your patient-focused,
Exactly.
patient-centered environment.
And then the next benefit, which is to me the most exciting benefit of doing awake surgery, is the recovery is so much faster. I don't need to give IV narcotics. We reduce or eliminate the amount of opioids and narcotics that we have to give to our patients. And I can examine them and interact with patients during the operation. So if you're coming in with back and left leg pain, I can tell when your left leg pain is gone because I can ask you.
Holy cow.
Yeah.
So it's obvious what awake means, but are you literally able to watch like a TV or a camera of you operating and like see that, or does that scare people and you don't want to?
So I've had some physicians who are also patients who actually watched the surgery and were a little bit of a backseat driver.
Totally. You made a wrong left at Albuquerque. Go right there.
But I've had other patients watch an iPad and watch the Travel Channel. Most patients like to wear noise-canceling headphones and listen to music.
Yeah.
And if we need to talk to them, we just turn off their music and talk to them for a little bit.
Yeah. Well, that's great to see that innovation in the medical field. And then finally, to close off here, just a little tease, because I was really excited to get this from you. You've got a special program coming up soon.
Oh, yeah. So we're approached by a major national cable station to do a reality TV series on awake surgery, just because it's so innovative and so interesting. Just a little teaser. I can't give you a lot more information than that, but we are casting for patients to be in the television show.
Can you be healthy and just kind of say like, I just want to be on TV?
No, absolutely.
No, so I got to hurt myself if I want to get on this TV. Okay, all right, I'll keep that in mind. Well, thanks a lot, Dr. Braxton. I really appreciate you coming on and for innovating in the medical field. That's so huge. I'm so supportive of anybody that's wanting to innovate and bring technology forward. So thank you for that.
Well, it's an honor to be here, and thanks so much, Eric.
Yeah, good luck at Birds of Prey today as a spectator.
Thank you. All right.
All right. We got plenty more Good Morning Vail coming up after this, including a chat with the Vail Symposium here in the studio.